Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. We chat with Kent Batman, who's a regular contributor here on The Price of Business. He works with a great company called R&P Solutions, and we're doing a series of stories on healthcare professionals who have been recognized in the greater Houston area for their expertise, and delighted and in fact, this is the first in the series, and delighted to have our first guest in that series. Kent, real quickly, tell us about R&P Solutions, and then tell us a little bit about your guest today.
R&P Employer Solutions is a fully licensed PEO, and we hire employees and then take most of the hassle, the bureaucratic hassle of having employees. Doing that, we can get lower prices on health insurance and things like workers' comp. So R&P is a great option for today. Dr. David Dennison is a board-certified periodontist. In fact, he holds a prestigious title of Diplomat of American Board of Periodontology. Dr. Dennison's articles have been published in many of the nation's leading dental and medical journals. Doctor, please tell us about your practice.
My practice is treating gum disease and doing dental implants, which are used to replace teeth that are missing, either from trauma or from gum disease and its bone destruction.
So tell us a little bit about your history, your background, and the background of the practice, Doctor.
I started really my professional career in 1978 when I received my Ph.D. in anatomy with immunology research. I moved to Houston at that time and joined Baylor College of Medicine to do research there. And in 1981, I decided to go to dental school. Very quickly, I graduated in 85. During that time, we made some important discoveries on the very, very first signs of HIV infection in the mouth. And from there, I actually joined faculty at the dental school for about 13 years, during which time I got my periodontics training. I had grown up just outside of Branson, Missouri, and loved working with people and decided to go into private practice. And so I started in practice in 1995 and have been having a blast treating patients since then.
Very good. Kent, your question?
Yeah, how is your practice affected by what's going on in Washington with things like the Affordable Care Act?
We really haven't seen much effect. The way dental insurances often work is they have a cap. They will pay for around $1,000, $1,500, some $3,000 a year, and the treatment that we see that they need has not really been affected. From what I have seen, Obamacare and the policies have not affected the insurance coverage.
Very good.
Yeah, from what I understand, that's pretty much been the case internationally. You know, all of a sudden, all the guys who went to dental school and to sit at medical school proved to be geniuses around the world because it seems like wherever, in most places, at least in Europe, wherever socialized medicine exists, dentists seem to continue to practice uninfringed. Is that what you've seen as well, Doctor?
That's my impression. I think for right or wrong, I think dental care has been considered optional and not mandatory. And what we're seeing now is that there are many more connections between health and dentistry, but yet the insurance companies and the medical profession hasn't bridged all of those gaps at this point.
Yeah, go ahead there, Kent.
Which today is an advantage. But you mentioned that several things related to the mouth also affect overall health. Can you give us some examples?
We've known for quite a long time that there may be relationships between cardiovascular disease and low birth weight babies. We have very, very little question that there's a relationship between diabetes and periodontal disease. The thing that's interesting specifically about diabetes is that high blood sugar impairs the ability of the body to fight infection. It also impairs wound healing. Well, periodontal disease is a significant infection, and in fact, it elevates blood sugar. So we end up with a feedback mechanism where periodontal disease makes diabetes worse. The diabetes being worse makes the periodontal disease worse because of the immune system compromise.
Let me ask you real quickly before I get back, what is your website for people to get more information, Doctor?
Our website is gums-houston.com.
Good job. Okay. Go ahead, Kent.
Well, Doctor, if untreated, then what's the next complications?
With any of the periodontal diseases, what the body is doing in the periodontal disease scenario is trying to control the infection by trying to get rid of the tooth. Ironically, I have treated some extreme compromised cases where the best solution has been to take all the teeth out. That's a very dramatic situation, and tooth loss is debilitating, as people who wear ill-fitting dentures know. But that is the ultimate point, is loss of the teeth.
Yeah, that's incredible. And let me ask you in terms of changes. It seems like we hear a lot, of course, about medical breakthroughs. It's interesting to see that diabetes, and that creates problems dental-wise as well. And I was just hearing this week that they're talking about a potential cure for diabetes, which is fascinating. But I don't know many other healthcare professions that have seen more progress than the dental arena. Talk a little bit about that.
The progression in dentistry has been phenomenal. I think dental implants have been remarkable. We talked about patients losing their teeth. We're now able to bring a patient in that has a denture, and in fact, they can walk out in 4 to 5 hours with teeth. We're able to put the implants in, connect denture teeth to that, and they don't have to remove their dentures anymore. There's no clicking, clacking, and everything else that we associate with that. We've had some amazing advances in the materials that we use. There's been some controversy, and right now in the periodontal community, there certainly is controversy regarding the use of lasers in dentistry. And in my opinion, I think that lasers have some very valuable points. I think that periodontal disease is an infection, and I think controlling the infection is the key thing with treating periodontal disease. We're still using some of the same tools that we've been using for the last 25 years, and it's very, very effective therapy.
Interesting. I want to mention real quickly, by the way, that Kent can be found at rpemployersolutions.com. That's rpemployersolutions.com. Final thoughts, Kent, as we wrap up this conversation, and thanks, Doctor, for joining us. Your final thoughts, Kent?
I just think it's important that we all follow up on everything that's going on in healthcare and make arrangements to take care of things early.
Yeah, makes a lot of sense to me. Great topic. I look forward to doing more with you. Do want to remind the listener that the best content here, it shows up over there at usdailyreview.com. While they're liking on Facebook, follow it on Twitter. Thanks so much, gentlemen. We'll be back with much more for you right here on The Price of Business.